everyone. On behalf of the Global LMIC Cerebral Palsy Register team, thank you for joining today's webinar on practical evidence-based communication support in low resource setting. Before we begin, a few quick housekeeping rules. Please keep your microphone muted during the presentation and share any question or comments in the chat box. We will discuss them during the session. It is now pleasure to hand over my mic to Amanda, who will introduce the speaker and lead today's session. Amanda, over to you. Thank you.
Thank you, Mahmood, and thank you to Ishrat for hosting this wonderful webinar and inviting us here tonight. We are based in Sydney, so it's 7 p.m. on a Friday evening for us, and in a second we'll get you to just share a little bit about who you are and where you're from. But I just wanted to start out to say that we have our apologies from Rhonda Shahada, who is one of our speech pathologists who is joining us today, who is unfortunately unwell. So instead of having 4 of us on tonight, you will have extra time from 3 of us. So you'll get some more time for questions at the end and a little bit more extra time to go through some of the detail. So I think that's a great thing. Not great that Rhonda is unwell, of course, but we are all speech pathologists. So 3 of us, myself, Naomi Hodder and Dr. Anne-Marie Murphy. And we are all part of the research in Cerebral Palsy Alliance Research Institute and Sydney University, based at Sydney. And we do lots of research for children with cerebral palsy. Naomi's research is primarily around infants and babies who are at risk of cerebral palsy, and she's conducting a research trial called the Early Communication Study that is looking at parent and infant interactions and comparing 2 types of intervention. We've got an intensive parent training guide compared to standard care. And Anne-Marie did her PhD looking at literacy and for children with developmental disability. And she is now using that knowledge to help with cerebral palsy and implementing that into technology side of things. So she's part of our technology team as well as our early intervention and early detection team at Cerebral Palsy Alliance Research Institute. So we are very honoured to have them with us today. The way that the structure of our presentation will work is that we'll start off with Naomi's talk, which is sort of the early years of communication and some strategies that you can use there to support communication for children with cerebral palsy in those first couple of years of life. And then we'll move on to Naomi, who will talk a little bit more about ways that we can incorporate technology and support some older children with cerebral palsy as well with their communication skills. Then at the end, we will come back and we will do a Q&A session. We've allowed about half an hour for that, so please add your questions to the chat box as we go through, and we will answer those at the end. But it will be sort of a panel, so if you have any questions, add them in and we will address them at the end. You can add more in as we go as well. It should be a very exciting and interesting talk. We hope you get lots out of it. And the idea behind all of this is that we bring our knowledge of speech pathology and assessment and intervention for children with cerebral palsy, but really you as our audience bring that knowledge and experience of your local settings. So we can learn as much from you and your innovative and problem-solving ideas. So as well as the questions that you have in the chat, if you have any resources or ideas of ways that you can incorporate that, please do share those as well, because I think they will be valuable for everybody. We all have a little bit of experience working in low resource settings within Australia and internationally, but I don't think we have as much wealth of knowledge when it comes to that as many people in our audience tonight. So your information and your knowledge and wisdom is really valuable to share as well. So please feel free to share your ideas too as we go along in the chat, and I'll bring them up to discuss at the end. Okay. So we've got a couple of Mentimeters if you are familiar with them. great, but essentially should be fairly straightforward, let's hope. And this is just a question about where you're joining from. So if you've got your phone handy, or if not, you just type in the menti.com website into your internet browser, or if you've got your phone handy, you can scan the QR code. And then just let us know which country, which city are you joining from, so we get a bit of an idea. That might help with some of the problem-solving ideas that we come up with. So lovely. Got a bit of a range, and it will of course depend on time zones, but maybe people up at different hours watching the World Cup lately too. Brilliant. So we've got a couple of people from Lebanon, Bhutan, Australia, Spain, South Africa, Ghana. We've got almost all the continents covered. Cambodia, another one from Australia, two from Cambodia. Nice. A couple of other people who were Kenya. Lovely. Out of all of these countries, I've been to Australia and Spain. I'm yet to go to Lebanon, even though I lived in Bahrain for about 4 years. Never made it to Lebanon. Haven't been to Africa yet, and haven't really explored much of Asia, if I'm honest. Zimbabwe. Oh, fabulous. All right. We'll move on to our next question. That gives us a good indication that we're all from all over the world. And then our next question is, what is your profession or your role? What makes you interested in attending today? Is it something that you especially interested in? Your family or friend with someone with cerebral palsy, or something else? If there's not an option for you there, if you're an other, maybe you want to put it in the chat as well so we can see. Physiotherapists. Yes, you can also add to the chat box here. If you can't scan, you can't get Mentimeter working, so please feel free to do that too. Nice. Really interested to see what these other ones are, so please do write it in the chat. There's a researcher. I wonder if this is frozen. Oh, here we go. A few researchers. Excellent. Wait another couple of minutes. One physician, two physicians, orthopedics, surgeon, physio.
Amanda,
Yes.
sorry, your voice is breaking. I'm not sure whether
Oh,
I'm
sorry. Let
getting
me
it.
get louder.
Uh, what
Hopefully,
do you think?
that connection. All right. Lovely. So we've got a bit of a range here, which is lovely to see. I thought we might have some family or friends of people with cerebral palsy, but don't seem to, but that's okay. All right, lovely. We'll move on and I will hand over to Naomi, who, oh, we've got a nurse, another speech therapist. Great. I'll stop sharing my screen, Naomi, if you would like to take over and share your screen. You can. Thank you, everyone. Good to get to know a little bit about you.
Thanks for that, Amanda. Let me just get my screen all sorted so I'm ready to present. Well, thank you very much for having me tonight. Paul, and like Amanda said, I work at the Cerebral Palsy Alliance Research Institute, and I'm also a research student at the University of Sydney. And I'm really looking forward to sharing with you what I've learned so far about supporting early communication development. And just as importantly,
sorry, I'm just going to interrupt you for a sec. We can sort of half see your slides.
Yeah, it switched the screen. Let me try that again. Oops. How's that? That's better. Thank you. Yeah, I'm really keen, like Amanda said earlier, just to also learn from your insights and experiences about how we can support early communication development in a range of different contexts. So do feel free to ask questions, but please also make some comments as we go. And my email address is on this slide here, so you're more than welcome to get in touch after this presentation as well if you want to continue that conversation. But before we begin, I do want to also thank Amanda, because she has very kindly shared her photographs from her recent trip to Bangladesh, which you'll see are used throughout this presentation today. But let me give you a quick overview of what you can expect throughout my part of the presentation. So I'm going to talk with you about early communication in CP, and then we will have a look at why everyday interactions are important for communication development. And then we'll discuss some practical interaction strategies that I hope you can adapt and implement into your day-to-day activities with people with CP. And then I'll share some resources that I know of that are available, and perhaps you can share some of the resources that you're familiar with. So we know that the majority of individuals with CP have communication difficulties, and that as many as 1 in 4 have no functional speech. Even though there's preliminary research that's been conducted, and we've identified some factors associated with increased risk for communication impairment in children with CP. We've seen that there's correlations with the nature of the neurological impairment, clinical history, type of CP, and the co-occurring impairments. But much more research is required in this area for accurate prognostication. So there's quite a bit of literature about what communication looks like in people with CP from 2 years and older. Because earlier detection of cerebral palsy has become possible, new research is now emerging, which is really exciting, helping us to understand more about how communication develops for infants with CP. So for infants with CP, their motor impairment may mean that they're unable to engage as readily, and their communicative cues and their body movements, facial expressions, vocalizations may be more ambiguous. We also know that the differences in communication development can actually emerge very early. So deviations in babble and early language skills have been identified from as early as 9 months of age. So communication challenges aren't simply appearing when children are expected to start talking, but they're often emerging much earlier Well, why does this matter? Because communication skills at 2 years of age are actually predictive of longer term communication outcomes. And the impact extends well beyond communication itself. So research suggests that communication skills are actually more predictive than even motor skills of later academic performance, social functioning, and maternal well-being. So it raises a really important question. When we think about very early intervention, should we be focusing not only on motor development, but on communication from the very beginning as well? Let me share with you a brief overview of what the literature tells us about communication interventions for infants with CP. So reviews of speech and language interventions for infants under 2 years of age who are at risk for CP have identified 3 main findings. That is, firstly, there are no communication interventions that have been designed specifically for this population. Secondly, there is relatively little research in this area. And thirdly, the available evidence is generally low to medium quality. And while that sounds all doom and gloom, it isn't. It does highlight an important gap in the evidence, but there is encouraging news that one approach shows some promise, and that is parent-infant transaction interventions. So interventions of this kind focus on strengthening everyday interactions by helping caregivers to recognise and respond to and then build on their child's communicative attempts. Examples of this include programs like Premistart and the pre-linguistic milieu teaching, as well as Hanen programs. So my colleagues and I are currently reviewing the latest evidence in this area, and you'll need to wait for that publication to find the full findings. But one message is already clear, and that is that thanks to advances in early diagnosis, we can now identify many infants at risk of CP during a period where their brain is especially responsive to experience. However, the evidence for early communication interventions have not kept pace with these advances. So in other words, we're getting much better at identifying who could benefit from communication support, but we still have so much to learn about what interventions work best for infants and toddlers and when those interventions should begin. So to help answer some of those questions, our team is, like Amanda said, conducting the first ever randomised controlled trial of a communication intervention for infants with CP, with a particular focus on trying to identify the optimal timing to start communication intervention. While we continue to build on that evidence, the current literature does suggest that supporting everyday caregiver-child interactions might be an important part of the solution. In fact, the Early Intervention Guidelines provides conditional recommendation for parent-infant transaction interventions to support caregivers to build relational connections with their infant, to strengthen reciprocal back and forth communicative exchanges, and to foster active communication participation. What's important to note is that these interventions don't teach communication in isolation. They focus on strengthening everyday interactions between a child and the people who know them best. And that's really powerful because these interactions happen naturally throughout the day. By making the most of these moments, children receive lots of opportunities to learn and practice communication. So while communication intervention can include specialised approaches such as motor speech strategies or even AAC strategies like Anne-Marie will talk with you about shortly, some of the most powerful learning opportunities can happen within ordinary moments that infants are already sharing with the people that are around them, because that's the context in which communication occurs. So as we think today about supporting communication, I'd encourage you to think about how we can strengthen these everyday interactions and then embed some specific communication strategies within them. Early communication skills emerge through ongoing reciprocal exchanges between infants and their caregivers. So So just like the dance that you can see here, both communication partners continually respond and adapt to one another, shaping each other's communicative behaviour over time. But let's consider what this means for infants with CP who may show
when that it's a bit difficult to hear you.
Okay, let me pause it there. Can you hear me now?
Yes.
Okay. But let's consider what it means for infants with CP who might show fewer social initiations. So their communicative signals might be harder for caregivers to recognise and interpret, making it difficult to establish that interactional synchrony. Secondly, caregiver interactive behaviours may also be altered. Research suggests that when infants' cues are less clear, carers respond less consistently or may adopt a more directive and intrusive interaction style. And in addition, the stress of caring for a high-risk infant can also reduce the opportunities for positive communication exchanges. And this matters because caregiver sensitivity and responsiveness are powerful drivers of development. When caregivers recognise and respond to their infants' communication attempts, children show better outcomes not only in communication, but also in social, cognitive, and motor development. But before we look at some specific interaction strategies, let's first think about what types of interactions these strategies can be integrated into. So many communication opportunities happen throughout interactions that we have in daily routines, things like meal times, getting dressed, washing, or going out into the community. They also happen during social games and songs, things like peekaboo or tickles, favourite nursery rhymes. People games and songs will obviously look quite different across families, cultures, and communities. Play is another great opportunity for communicative interactions. So this might be things like rolling a ball or blowing bubbles or playing with a toy together. And then sharing a book is another opportunity for communicative interactions. So while the activities may vary, what matters most is the quality of the communication that happens within them. So next, we'll look at some practical strategies that you can use during everyday interactions. And although these might look different depending upon the child's age, abilities, and the situation, the same core principles will apply. And as we go through them, what I want you to do is to keep one specific interaction in mind that you can think about how you can apply these strategies into. So I want you just now to think about and choose an interaction that you and a child with CP genuinely enjoy doing together. So favourite activities are a great place to start because children are more likely to communicate when they're motivated and engaged, whether that's to request, to protest, to comment, or to just share enjoyment with you. So as you think of an activity, try to think of one as specific as possible. So instead of thinking just play, think of a particular play activity, such as rolling a ball back and forth or blowing bubbles. If you think of that you want to do a routine, then pick a specific routine. It might be breakfast or getting dressed. Meaningful, enjoyable activities create natural opportunities to support communication development. Excuse me. Then next, I want you to think about how you can position yourself in this activity to encourage interaction. A simple but powerful strategy is to bring yourself to your child's level. I'll pretend this is my child here. Bring yourself to your child's level so that you are actually face to face. You want to be in close proximity to them, ideally within 30 to 50 centimetres. But being face to face makes it much easier to notice each other's facial expressions, their eye gaze, their gestures, their sounds, and that helps to create positive back and forth interactions. If your interaction involves an object, such as a book during shared book reading, or food at meal times, or a toy during play, it's important to think about where that object is positioned as well. You want to aim to position yourself so that both the object and your face are within the child's line of sight. This will make it much easier for the child to notice your facial expressions, your lip movements, your eye gaze, without having to constantly shift their attention between you and the object. And by reducing this effort, you create more opportunities for shared attention and communication. This actually often takes a bit of planning, because naturally we are much taller than a young child. They could be sitting on the floor looking down at a toy in front of them, and so it takes a significant shift of eye gaze for them to look up to you, who's sitting much taller. Or they might even be sitting on your lap during activities like book sharing or meal times, because you're supporting their posture in that position. But that means that they need to turn their whole head to try to reference your face. I love these photos here from Amanda's recent trip to Bangladesh, because they show how we can be quite creative with the resources that are available to support positioning. So although these examples were set up to support safe and effective feeding, the same seating support, in combination with the adult adjusting their own positioning, can help to establish face-to-face positioning for effective communication. So as you think about the interaction that you chose earlier, I want you to consider how you might need to adapt your position or the child's position to make it easier to interact face-to-face. For example, if the child is sitting on the floor rolling a ball, perhaps you might want to lie on your stomach in front of them so that your eyes are at a similar level to the child and the object that's in front of them. That will allow you to easily see and respond to one another. So once you've established face-to-face positioning, the next step is to wait for your child to take the first turn in the interaction. This sounds really, really simple, but it can be surprisingly difficult, because as experienced communicators, we are often quick to talk, to ask questions, or to offer help, because naturally we want to connect and ensure that at no point the connection between ourselves and the child is broken. But if we always take the first turn, children have fewer opportunities to learn that they can initiate communication. So by waiting, you actually create space for the interaction to be child-led. And this is important because communication is about empowering the child to send a message that is meaningful to them. So now, as you think back to that interaction that you chose earlier, what might waiting look like? So at mealtime, it could be holding up the food in front of your child's line of sight and waiting to see whether they might show you if they want it or not. During book sharing, it might be holding up two favourite books near your face and waiting to see if the child lets you know which one they want to read. The key is just to pause while you wait to show the child that you are ready to listen and to give the child the opportunity to take that first communicative turn. Then the next step is to observe the child, tuning in to all their communicative cues, looking for any message that they may be sending, whether they're sending it intentionally or unintentionally. So paying attention to their body movements, facial expressions, eye gaze, and their vocalizations. These early behaviours will provide valuable information on what the child is interested in, what they're feeling, or what they're wanting to communicate. By tuning into the child's focus and their communicative turns, you establish joint attention. And that's a shared focus between you and the child, and that's key for communication. For many infants and toddlers, it can be really difficult for them to focus on or communicate about something that the adult has initiated. But by following the child's lead and joining in on their focus of attention, you create the shared attention that's needed for meaningful communication. But how do we do this? What does observing look like? So I want you to picture the child in the interaction that you chose earlier. And as you observe them, what body movements might you notice them using that could be sending a message? So are they twisting or shifting their body? Are they turning their head? Are they moving their arms, their legs? Are they maybe using an unconventional gesture? So it might be pushing something away, or a more conventional gesture. They might be pointing at something. Remember that all of these behaviours, regardless of whether they're purposeful to send a message or if they're unintentional, they can still be meaningful. Next, just think about the facial expressions you might observe the child in this activity. What do you think you would notice? Would they be smiling, frowning, grimacing, widening or narrowing their eyes, opening or closing their mouth? Facial expressions will tell us a great deal about what the child's thinking, feeling or enjoying, and by paying close attention to these subtle cues, you're much more likely to understand their message. And then next, think about their eye gaze. As you observe them in this interaction, what will they be looking at? Do they shift their gaze between you and the object, or between different people and different objects? Eye gaze will help us understand what the child is interested in, what they're thinking about, what they want to communicate. And that will give you valuable clues about their message. And then lastly, think about the child's vocalizations. So the activity that you chose earlier, the interaction, what sorts of sounds do you expect the child will make? These might include squeals, coos, cries, laughs. If they're beginning to babble, what sounds do you hear them make? Or if they use a word or phrase, what did they say? Again, all of these vocalizations are important clues, because even before a child uses words, their sounds can express their feelings, and their sounds can be used as attempts to gain your attention. And as the children's speech sounds develop, they might begin to use particular sounds consistently to represent something that's meaningful. So I want you to consider how you can practice observing a child's communicative cues across a range of everyday interactions. Subtle communication cues can be very easy to miss, particularly in infants who have limited movement, limited facial expressions, or limited vocalizations. But one useful approach can be to record short videos of the infants interacting with their caregivers. Watching these videos back afterwards with the caregivers, when they're not actively involved in the interaction, can make it easier for them to notice some of the really small but meaningful cues that may have been missed in the moment. Observing the child's communicative cues helps caregivers to become more sensitive to their child's communication attempts, which research shows is so important for communication development. Importantly, observation also helps us to understand the child's current communication abilities, how they're using nonverbal and verbal behaviours to communicate. And understanding this will provide a foundation to identifying some specific and suitable communication goals to support their ongoing communication development. Then, once you've observed the child has taken a communicative turn, regardless of whether they were purposefully trying to send you a message or not, it's important to treat the communicative cues as meaningful. And you do this by providing a prompt, contingent response, because that is how children learn language. As infants begin to realise that their sounds and actions can influence the people around them, they start to communicate more intentionally and more consistently. So prompt responses matter. Research shows that when caregivers respond within 3 seconds, infants are more likely to adapt their vocal patterns to be more like their communication partners. But when the responses are delayed, this effect is reduced. We also know that contingent responses are important. In a recent study of premature infants in the NICU, infants had recordings of their caregiver's voice when they showed signs of active engagement. And those infants later showed stronger speech sound discrimination, and at 2 years old, they showed better language outcomes. But what do we mean by contingent? Children learn language by finding patterns and connections between what they experience and the words that they hear. Sometimes we call this word-to-word mapping. In everyday environments, there are a lot of competing sights, sounds, and activities which can make the process a whole lot harder, but contingent responding helps to make those connections clearer. So by noticing what the child is focused on and matching your language to that object, action, or message, you create a really clear link between the child's experience and the language that they hear. And this shared focus reduces all the distractions and supports more efficient language learning. One way to provide a contingent and prompt response is through imitation. So by copying a child's facial expression, their sounds, or their actions, you create a really simple serve and return interaction. For example, if the child bangs some blocks, you bang some blocks. If the child's bottom lip begins to curl, you respond with a really exaggerated, sad look on your face. These immediate matching responses help the child to recognise that their actions have meaning and they can influence others, supporting the development of their intentional communication. Alternatively, you can respond by interpreting the child's communicative attempt. So a helpful question to ask is, what would the child say right now if they could? For example, if a child pushes a banana away, you might shake your head and say, no banana. By putting words into the child's, putting the child's message into words, you're acknowledging the child's communication and you're modelling the language that is directly connected to their experience in that moment. Another way to respond contingently is using descriptive language to comment on the child's current focus of attention. So rather than asking questions or directing the activity, you simply aim to provide words for what the child is seeing or doing or experiencing. So for example, if the child is washing, you might say, you're splashing the water. If the child looks at the cat that walks by, you might say, that's a big cat. By talking about what the child is already focused on, you create clear connection between their experience and the language that they hear, supporting their word learning and their comprehension. Another way you can respond contingently is when a child communicates intentionally to you, you can repeat their message and then expand on that. So we often call that expansion. For example, while a child is playing with bubbles, if the child signs more, you might respond by signing more bubbles. And by doing this, you acknowledge the child's message while modelling a slightly more advanced language form. This provides the child with a grammatically richer phrase that builds on their language, the language that they're already using. So think back to the activities that you identified earlier and the communicative behaviours or vocalizations that you expect the child might use. And just have a think, how could you respond to the infant's communicative cues in a way that is prompt and contingent? Would you imitate their actions or sounds interpret their message, comment on their focus of attention, or expand on what they've communicated. Just take a moment to think which strategy you feel would be most natural and meaningful within that interaction. Let's see if this video will start here, and this just gives a nice example of that serve and return.
Baby serves a smile, a coo, a babble, a gesture, and the parent or other adult caring for that child returns a response that is connecting to what the baby did. Baby makes a sound, you make the same sound back. The baby points to something, you look at that and you point to it yourself. That's the key. It goes both ways. The baby can start it, the parent can start it. The key is how you respond. Serve and return is not necessarily something that works the first time you try it, but the more you practice, it actually gets easier.
All right, so by optimizing responsivity through prompt contingent responses and treating all those communicative cues as meaningful, even when they're not yet intentional, we help infants to learn that their actions can influence others, and this responsiveness supports the transition from pre-intentional to intentional communication. And that encourages much more frequent social initiations and lays the foundation for later language development. After you provide a prompt contingent response, next you must wait for the child to have another opportunity to take another communicative turn. So repeating this cycle creates balanced back and forth exchanges and strengthens the reciprocity of the interaction. When the infant is frequently engaging in positive reciprocal interactions, you have a natural foundation then to embed more specific communication strategies. And in this way, we can then support the development of communication skills within meaningful, enjoyable social exchanges. Have a short look at this video here of an example of a parent who's observing, waiting, and listening with their child.
Time for snack?
Sometimes parents don't realize how important it is to observe, wait, and listen during everyday activities. Watch what happens when Mom doesn't observe, wait, and listen to Sean at snack time.
Oh, have a cookie. Come on, we gotta go. Have a cookie. Yes, yummy cookie. There we go. Very good. Look, Mommy have one. Have a cookie.
Sean doesn't even look at his mom. All he does is push the container away. It's no fun when Mom isn't paying attention to anything he's trying to tell her. Look at the difference in Sean when Mom observes, waits, and listens to him. When Sean is given the chance to take the lead, he communicates so much more.
Drink. Here you go. Oh. Pour drink. There. Silly mama. Mama, give me a drink. Oh, silly mama. Mama? Cow. Cow drink. Walk. Cow walk.
You can see as Mum observes.
Let's look at how parents observe.
You can see as Mum observes, waits, and listens there, she gets many more opportunities for back and forth communication with her child. But what happens when you wait and wait and wait and the child isn't taking many communicative turns? So in these moments, we can create opportunities for the child to communicate by thoughtfully setting up the environment or the interaction to encourage them to initiate, to respond, or to take another turn. So let's look at a few simple strategies for creating communication opportunities within everyday interactions. The first is to offer a simple choice. So you might say to the child, do you want ball or car? And offering choices like this can just provide a natural reason for the child to communicate. It also clearly models the language that's associated with each option, helping the child to learn the words that represent those objects. But importantly, the child also doesn't need to use words to respond. So if they're not able to yet imitate the language when they're offered a choice, if you use a visual support like that with the actual objects, they can still express their preference either through eye gaze or their body movements. And this allows the child to participate successfully in the interaction while continuing to build their communication skills. Another way to create opportunities for communication is through communication temptations. These are just really simple situations that encourage the child to communicate because they want something or they need help. So, for example, you might place a highly motivating item within sight but slightly out of reach. Or you might introduce a toy that is difficult for the child to operate themselves, such as something like a little wind-up toy that they need your help with to be able to activate. These situations create just natural opportunities, giving the child a reason to communicate. And the child might do so verbally or non-verbally to request for help and interact with you in that way. Another strategy is bit-by-bit delivery. So instead of providing everything all at once, you might offer small amounts and then pause, creating opportunities for the child to communicate more. So, for example, you might give just one spoonful of rice and then just hold the rest of the bowl in sight, but again, out of reach for the child, waiting for them to signal that they want more. Or when they're playing with something like a posting toy, you might just give them some of one piece at a time for them to put in before they need to request for the next piece. This approach naturally builds multiple opportunities for the child to take communicative turns. The child could use verbal, non-verbal ways to frequently respond and request more to support their communication development. And another way to create an opportunity for a child is to pause but during a familiar or enjoyable activity and then wait for the child to indicate that they want it to continue. So, for example, during a game of peekaboo, you might say, pika, then pause and wait for the child to either pull the scarf down or make a noise for you to then say, boo. You can use this technique as well while singing a familiar song and then pausing at the high point in a song to see if they might respond in their own way. And by creating that expectant pause, you provide, again, just a natural opportunity for them to take a communicative turn and actively participate in the interaction. So here's an example here of a mum pausing and waiting during a familiar song.
Old MacDonald had a farm, E-I-E-I-O. And on that farm he had a... What did he have? Oh!
Mimicking is a great way to help your child start forming words. If he makes an animal noise, try making one back. If he is saying a word, try to guess it. By responding when your baby makes noises, you encourage your baby to learn to talk.
E-I-E-I-O. And on that farm he had a... Oh, moo cow! E-I-E-I-O.
Right. So once your child is engaging in positive back and forth interactions, you can then set some specific communication goals for them and embed some communication enrichment strategies into these interactions to support the child in starting to use some more sophisticated communication skills. So to do this, you want to start by considering their current communication abilities and identifying a realistic next step for them. So the aim is to support the child to communicate messages that are meaningful and useful to them in their everyday interactions in a way that can be understood by others. For example, if a child is producing sounds during vocal play but isn't yet using them purposefully to send a message, a suitable next step might be to encourage them to use a meaningful sound to continue an activity or to request more of something. By targeting skills that are just beyond the child's current level, we can create opportunities for success while gradually building more effective and intentional communication. Once you've identified a specific communication goal, you can then intentionally model that communicative behaviour in your interactions. So using short, grammatically correct phrases and then emphasising the target gesture, sign, sound, word or phrase that you want the child to learn. So for example, if the goal is that we want the child to request more, you might repeatedly say, more bubbles, more car, more drink during motivating activities. By hearing that target language used consistently in meaningful context, the child is going to be provided with clear examples of how they can communicate messages that are important to them. To support the child to achieve their communication goal, it can be really helpful to use visual support, such as objects, gestures, and signs along with the spoken language. So, for example, you might use a gesture to sign ready, set, go. And by offering a visual support, that can help the child's understanding of the message, but it also provides them with an alternative way for them to communicate. And this means that the child can participate and express themselves non-verbally while their spoken language skills are still developing. And then for language learning, repetition is key. So repeating the communication targets frequently throughout the interaction and in different situations. As the target words or phrases become familiar and become predictable, then the child begins to anticipate what comes next. And at that point, your pause and your waiting becomes especially powerful, because when you stop and wait expectantly, the child might attempt to communicate the next word, sign, sound, or gesture themselves. So providing repeated, meaningful models and creating opportunities for participation, we encourage the child to move from understanding the target language to actively using it in communication. So I hope from that you might have one or two ideas on how you can optimise day-to-day interactions to foster communication. And as Anne-Marie gives you more specialised AAC techniques, hopefully you can integrate and embed these into these interactions. But before I finish up, I just want to share a couple of resources that you might find helpful. The first is the Communication Matrix. This is an online assessment. It's designed for clinicians or caregivers to use, and it includes a series of questions to guide you in considering the non-symbolic and symbolic communication skills of the child. It has been translated into a range of different languages, like those that you can see here. Alternatively, another accessible assessment is the MacArthur Bates Communicative Development Inventories. This assessment has a much stronger focus on specific word inventories to record what the child understands and those that they express. However, there is still a small section that looks at some of the non-verbal communication skills. One of the advantages of this inventory is it has been adapted for many different languages. And the last resource that I'd like to share is the It Takes Two to Talk guidebook. So this is designed specifically for carers of children 0 to 5 years, and it describes how you can foster communication through everyday interactions across those early stages of communication development. And many of the strategies that I've spoken with you about today are included in that guidebook. It has also been translated into some of these different languages that you can see here. but I'm also really keen to hear from the wealth of knowledge in this meeting today. So if there are other resources that you've found useful in optimising everyday interactions in those early stages of communication development, please share those in the chat, and we'll see if we can collate some of those resources that people share tonight so that you might be able to access them later. Thank you.
Wonderful. Thank you, Naomi. I loved it. I thought there were some really practical strategies, and I think it's excellent that as we get access to more and more parts of the world, and as the world becomes a much smaller place, that we see that resources are being translated into lots of different languages and to allow them to be used in different settings too. So thank you for sharing those. Please keep your questions and your resources and thoughts being shared, and we will talk to all of those at the Q&A panel that we will do at the end of this. And now I will hand over to Anne-Marie Murphy, who will talk to you a little bit about how to support communication through augmentative alternative communication.
Thank you. And can I just, has that shared properly? Can you see that?
Yes.
Fantastic. So as Amanda mentioned, my name is Anne-Marie. I'm a speech pathologist and research fellow at the Cerebral Palsy Alliance Research Institute, and I'll be talking today about augmentative and alternative communication. So as Naomi and Amanda both mentioned, I'll be talking about my experiences of working with people with who use AAC in Australia, but I'm really keen to learn from all of you about your experiences and any resources that you know about as well. I'm really open to questions, so please feel free to pop questions in the chat. And if you're not comfortable asking a question here today, feel free to reach out via email. It's up on the slide here, and I'll have it again at the end, and also happy to send through any resources. So today I will be talking about what is AAC, some of the different types of AAC, who might benefit from AAC, why use AAC and some of the myths around AAC use, how to implement AAC, what the research says about AAC in low resource settings, and some ideas and examples of low cost AAC. So what is AAC? So AAC stands for Augmentative and Alternative Communication, and it refers to all the ways that someone communicates besides talking. So people of all ages can use AAC if they have trouble with speech or language skills. I've used it with babies all the way up to adults in their 90s. And people might use AAC for different reasons. So for some people, it might be augmentative, which means it supplements or adds to their verbal speech. And for others, it might be alternative, so they might use it instead of speech. But what does AAC look like? So there's lots of varieties of AAC. It can be things like gestures, sign language, and facial expressions. These are all forms of AAC. It could be pointing to pictures or letters on a board. It could be using your eyes to look at letters or pictures on a board. It could be picking up individual pictures and handing them to someone to ask for someone or to make a comment. It could be pointing to symbols in a book. It could be writing words or letters. It could be pressing a button to say a message aloud. It could be selecting symbols or letters on a phone or an iPad or a dedicated communication device. Or for people who have difficulty using their hands, it could be something more high-tech, such as using a switch or using their eye gaze to make selections on a screen. So as you can see, AAC isn't just one thing, it's a broad range of communication methods. And these are typically divided into unaided forms of AAC and aided forms of AAC. So unaided AAC doesn't require any external tools or equipment, and it includes natural forms of communication. So things like gestures, facial expressions, pointing, signing, and vocalizing. And these methods are always available and often the first communication tools that people use. Aided AAC involves some sort of external support or tool, and this can range from really simple systems to really sophisticated technology. So aided AAC can be broken down into low-tech or high-tech. So low-tech options are things like objects, picture cards, communication book, and symbol boards. So they're often inexpensive and easy to customize, and they don't need batteries or internet access. On the other hand, high-tech AAC includes things like speech generating devices and tablets with AAC software, and these systems can be accessed through touch, or they might be accessed through switches or eye gaze so that people with significant physical disabilities can access them. And both low-tech and high-tech systems might be text-based or they might be symbol-based, so picture-based. It's really important to remember, though, that AAC is not a hierarchy where high-tech is better than low-tech or no-tech. Most AAC users benefit from a combination of methods rather than just one, and this is called multimodal communication. So when we think about children with cerebral palsy, there are 3 broad communication profiles where AAC might be beneficial. So the first is for children who are nonverbal. So we know that 1 in 4 children with cerebral palsy are non-speaking. So lots of these children will understand far more than they're able to express. So AAC provides a way for them to communicate their thoughts and feelings and to participate more independently in everyday life. So the next is children who are slower to develop spoken language. So lots of children with CP will develop spoken language, but it might be at a slower rate than their peers. So up to 60% of children with CP have receptive or expressive language difficulties. So this means they might have difficulty following instructions or have limited vocabulary, for example. So AAC can be used to support these children to learn language while their spoken language continues to develop. And then the last group is children who have speech, but their speech is difficult to understand or it's really limited. So around 80% of children with CP have some level of dysarthria. So this affects their speech clarity and intelligibility. They know exactly what they want to say, but they might have difficulty making their speech understood by others. So AAC can be used to supplement their speech to make their communication more effective and less frustrating for them. So as you can see, AAC can be used with people for a range of reasons. And there are some tools that can help clinicians and families to decide if someone might need AAC or if they might need some additional communication supports. So I'll show you 2 of these tools quickly now that can be used to help determine if someone might benefit from AAC. And both of these are freely available online. So the first is called the AAC Finder Checklist from Assistiveware, and this is the link for it up on the slide. It's a really simple screening tool designed to help families, teachers, and clinicians think about whether someone might benefit from AAC. And what I like about this checklist is that it doesn't just look at a person's diagnosis or can they talk. It asks you to think about the many different reasons that people might communicate and whether the person can do this. So for example, can the person make choices? Can they ask for help? Can they describe what's frustrating them? Can they describe their pain? Can they share their experiences? Can they participate in conversations? Can they tell jokes or make plans with friends? And the checklist also asks you to think about who understands the person's communication. So can they communicate only with close family members who know them really well? Or can they communicate effectively with friends, teachers, health professionals, and also with unfamiliar people? So sometimes a person can communicate really well with familiar people, but people who don't know the person well can't understand them. So this might indicate that they benefit from AAC. So the checklist really asks, can this person communicate everything they want to say to everyone they want to say it to across all the situations that matter in their life? And then the second tool I wanted to highlight, Naomi has just introduced for us as well, called the Communication Matrix. So unlike the AAC Finder checklist, which helps us to think about whether AAC might be beneficial, the Communication Matrix helps us to understand a person's current communication skills and what the next steps might be. So the matrix is designed for people who are at the earliest stages of communication, and it looks at how a person communicates and why they communicate across a range of different communicative functions. So one of the strengths of the Communication Matrix is that it focuses on what a person can already do rather than what they can't do. And it highlights what the next steps are for their communication development. So it can be completed online and it generates a visual profile that you can see up here, showing the person's strengths and their areas for growth. So it can be really helpful for setting communication goals and also for choosing AAC supports. It can be used to track progress over time, so it can help to monitor how someone's communication has changed after AAC supports have been introduced. And as Naomi mentioned before, it's free and it's available in 19 languages. So it's really useful across a range of settings and populations. So we've talked a bit about what AAC is and who might benefit from it, but why use AAC? So before we get into some of the common AAC myths, I wanted to take a step back and think about why communication matters so much. So communication isn't just a clinical goal or a therapy outcome, it's a basic human right. So back in 1948, the United Nations recognized that everyone has the right to express themselves, to access information, and to share ideas. And what I really like about this quote up here is the phrase "through any media." So it reminds us that communication doesn't have to happen through speech alone, that people communicate in lots of different ways, and AAC is just one of those ways. So building on that idea of communication as a human right, the Communication Bill of Rights describes what that should look like in practice for people with communication disabilities. So it outlines 12 rights, but the key message is pretty simple, that everyone has the right to learn to communicate, to be included in conversations about their lives, to ask questions and make choices, and to have their thoughts, opinions, and preferences heard. So importantly, it also recognises the right to access AAC and other communication supports when they're needed. So AAC isn't just about communication, it's about participation. So up here on the slide are just some of the benefits of using AAC. And these are the benefits reported directly from people who use AAC themselves. So people report stronger relationships, greater independence, and more opportunities to make decisions about their own lives when they have access to AAC. They also report feeling more included at school and in the community. And overall, AAC helps people connect with others and to have more control over their own lives. On the flip side, when someone doesn't have an effective way to communicate, there can be significant consequences. So people can feel frustrated, which can lead to challenging behaviours or acting out. They can feel isolated, and they also have fewer opportunities to show what they can do, meaning that people often underestimate them. And the research consistently shows that early access to AAC leads to positive long-term outcomes. So despite all of these benefits, there are still a lot of misconceptions that can delay people accessing communication supports. So we'll have a look now at some of the most common AAC myths and what the evidence actually tells us. So the first myth is that if we give someone AAC, they'll become dependent on it and they'll stop talking. And this is probably the most common AAC myth. The reality is, though, that research consistently shows the opposite. By removing the pressure and frustration of not being understood, AAC supports and actually increases spoken language. So when people can successfully communicate, they're more motivated to interact and to participate and to learn language. The second myth is that AAC is only a last resort, that we should try everything else first. The reality is that AAC should be introduced early rather than as a final option. So while speech, language, and other skills are developing, AAC can provide a way for children to express their wants, their needs, and their feelings. Having the opportunity to communicate using AAC can help other communication skills to develop. And delaying AAC can mean missed opportunities for learning and participation. Myth 3 is that people need to be a certain age or have specific cognitive skills to use AAC. The reality is that there are no age, language, or cognitive prerequisites for starting AAC. So we would never withhold spoken language until a child proved they were ready, and the same principle applies to AAC. So communication systems can be tailored to different ages, abilities, and developmental stages. And lots of AAC skills actually emerge because the AAC is available to the person to practice with, not before it's available to them. Myth 4, if they can speak some words, they don't need AAC. The reality is that AAC is a support tool. So it's not just a replacement for speech. As we've talked about before, lots of AAC users will still use speech in some contexts, but then they'll use AAC in other settings to make sure they can be understood. So the bottom line here is that some speech doesn't always equal enough speech for someone to get all their needs met. And then finally, myth 5, AAC only refers to expensive high-tech devices. So the reality is that AAC spans a wide range of options. As we saw earlier, it includes no-tech and low-tech options like gestures, sign language, and printed picture boards, as well as high-tech speech-generating devices. So AAC is more than just technology. So we've talked about why AAC is important. The next question is, how do we actually implement AAC successfully? So having an AAC system is only one part of the picture. Successful AAC implementation is about helping people to use AAC meaningfully in everyday interactions. So one of the most effective and evidence-based ways to teach AAC is through something called aided modelling. So aided modelling just means that the communication partner uses the AAC system while they are talking themselves. So if we were playing with the ball and I said, throw the ball, I might also point to throw and ball on the communication board at the same time as I said the words. And the expectation isn't that the child immediately copies what I've pointed to, but it just shows them how words can be expressed using their AAC system. So for children to learn to use AAC, they need to see other people using it to talk, and they need to see it being used lots of times before we can expect them to use it themselves. So we wouldn't expect a child to learn spoken language if nobody ever talked to them, and the same principle applies to AAC. If we want someone to learn AAC, they need to see it being used, and that's what aided modelling is about. Got a little video next of someone using aided modelling in a little play activity.
Modelling. Use AAC to teach AAC. No matter where you are in your adventure to build communication with AAC, modelling is a valuable strategy. Modelling means you point to words on the AAC tool as you speak. Ready, set,
go.
Go! Look, I like this book. Ah, look, we go to places, more outdoor places. Beach.
We go to beach.
We went to the beach.
So the other really important part of implementing AAC is that the people around the person learning to use AAC actually know how to use these strategies. And that's where communication partner training comes in. So this involves not working with the child, but working with the communication partners. So teaching parents, siblings, teachers, and other people in the community how they can support the AAC user during everyday activities. So for example, during an activity like playing with a ball, a parent might learn to model words on the communication board. They might learn to wait and pause and give the child time to respond. They might provide support only when it's needed. And they'll learn to respond positively to any and all communication attempts from the child. So lots of the strategies that Naomi introduced to us earlier also apply here when introducing AAC with someone. And it's important to remember that across the research, one of the strongest predictors of AAC success isn't the type of AAC itself, it's having communication partners who know how to support communication. So AAC works best when the people around the person know how to support communication during everyday interactions. Now, I know that was a very brief introduction to some strategies for implementing AAC. And what I've got up here on the slide is the Simple AAC acronym and framework, which helps to break all of this down into some easy to remember practical steps. So it's part of a freely available workbook online that's designed to help families and professionals to get started with AAC. And the website for it is up here on the slide. So it covers the most important things to remember when introducing AAC. So whether that's paper-based or with technology, the same principles apply. The first principle is to show. So this is where aided modelling comes in. So model and point to symbols on the AAC device while you talk. Keep it interesting. So focus on things the person enjoys and is motivated to talk about when you're introducing the AAC. Months and months. So remember that learning AAC takes time and lots of exposure. Just like children don't learn to talk overnight, learning to communicate using AAC also takes time. Pause. So don't do all the talking. After you've modelled, pause and wait and give the person time to think about what they need to do and to respond. Language. So a reminder to introduce lots of different types of words on AAC, not just words for requesting or for getting basic needs met. We all want to talk about more than just our basic needs. Explore. So allow people time to play with and explore their AAC system. Sometimes it's called babbling with the device, where the child is just able to explore and press any buttons and listen to what it says. So similar to when children are developing speech, they make sounds with their mouths to see what happens, and children learning to use AAC need time to do a similar thing. Make sure it's always available. Add words over time so that their language is able to grow and that it stays relevant. And comment on what's happening rather than just asking questions or testing. That helps someone to learn how they can use their device. So far, most of what I've discussed comes from the broader AAC literature, but we'll have a quick look now at what the evidence tells us about implementing AAC in low and middle income countries and what we can learn from that research. So recently, a colleague in my team at the Research Institute completed a scoping review that mapped all assistive technology research in low and middle income countries over the last 10 years. So they found 313 studies, but only 5% of these had explored technologies for communication. Most of the studies had looked at technologies for mobility, so things like wheelchairs and orthotics, followed by assistive technologies for vision. Of the 16 studies that looked at communication, most had looked at low-tech and high-tech AAC boards, with a couple looking at eye gaze access, and one looking at an app to teach sign language, and another looking at a gesture recognition system. And these communication studies were mostly conducted in Southeast Asian regions, but it's really clear from this review that assistive technologies for communication are not getting the attention that other assistive technologies are getting in LMIC contexts. There have been 2 recent scoping reviews that have explored AAC specifically in LMIC contexts. So the first was by Moutier and colleagues in 2022, and they found 18 AAC intervention studies across LMICs. So 2/3 of these were direct AAC interventions, so working directly with children, but really positively, 1/3 of these focused on communication partner training, which we know is really important for successfully implementing AAC. So the studies used a mix of AAC approaches. They used low-tech systems like communication boards and picture exchange systems, and also high-tech options like tablet-based AAC apps and computer-based systems. So this, again, is positive that AAC is not limited to just one type in these contexts. Another interesting finding was that 2/3 of the interventions were delivered in English, even when English wasn't the participants' home language. So this raises some important questions about the cultural relevance of some AAC supports that are being offered in LMICs. Overall, though, the outcomes were overwhelmingly positive. So across the studies, AAC was associated with improvements in communication, improvements in participation, improvements in communication partner knowledge, and improvements in communication partner skills. The second scoping review was published this year by Philip and colleagues, and it focused specifically on AAC interventions in India. So they looked at the last 30 years of research and they found 39 studies, with most being published in the last decade. So similar to the previous review, they found a mix of AAC approaches with studies using both low-tech and high-tech systems, including some locally developed AAC apps, which was really nice to see. And while a lot of the studies didn't report the language that they used for intervention, those that did were conducted in a range of local languages, which is again really positive. And as with the previous review, all of the studies reported positive outcomes from the AAC interventions. So the benefits included improvements in communication, improvements in language and literacy skills, reductions in challenging behaviours, as well as increased knowledge and confidence amongst parents and teachers. So even though the research in this space is still relatively limited, it's clear that AAC is both feasible and effective across a range of LMIC settings, but the systems and supports need to fit the local context. So that means having AAC systems that are culturally and linguistically relevant, and it means having parents, teachers, therapists, and other communication partners who know how to support AAC use in everyday life. So successful AAC is not just about the technology or the resource, it's about the people and the context around it. So as we saw, we don't necessarily need expensive technology to implement AAC well. There's lots of positive outcomes with no-tech and low-tech AAC options, as well as in training communication partners. So the next few slides highlight some practical, low-cost AAC options that can increase communication opportunities. So the first option is signing. So signing uses hand signs, gestures, and facial expressions to support communication. This can be keyword sign, where only the most important words in the sentence are signed, or it could be a formal sign language used by the deaf community. So signing could be used on its own, or it could be used alongside speech to help clarify what's said, could be used alongside communication boards or other AAC systems. And one advantage is that it doesn't require any equipment or technology, but it does mean that communication partners need to understand the signs that are being used. So partner training is really important for this. It also relies on children having the fine motor skills to do the signs. There are lots of free signing resources available online in local languages, making it easy for people to get started. So up here on the slide is an example here from the free South African Sign Language Dictionary online. Another simple low-cost communication support is a communication passport. So this is a short document that explains how a person communicates and how other people can support them. So it includes things like what a person's gestures, facial expressions, or vocalizations might mean. So for example, that vocalizing might mean I want more, or turning their head away means no. And these things might be obvious to family members and people who know the person really well, but they're not always obvious to someone who doesn't know the person well. So it can help to make sure that a person's existing communication is understood and responded to by everyone around them. Another low-cost AAC option is object symbols. So these are real objects or parts of objects that are used to represent activities, places, or things. So for example, a spoon might mean eating, a ball might mean play, or a leaf might mean going outside. And they can be used in the same way that symbols can to help a person understand what's happening or for them to communicate what they want. So by picking them up and passing them to someone, or by using their eye gaze to look at the object for the activity that they want. They could also be used in a visual schedule, like in the picture up here on the slide, to show the order of activities for that day. One of the most common forms of AAC is using pictures, photos, and communication boards. So pictures can represent a whole range of messages, not just basic needs like eating or drinking, but also feelings, descriptions, or locations. So they don't have to be printed symbols. It could be hand-drawn images or photographs, whatever is meaningful and accessible to that person. So pictures can be used on their own as a single picture. They could be organized into a communication board like they are up here on the slide, or they could be combined into a communication book with multiple pages. So this gives people access to even more words that they can use to communicate. And these can be made on whatever is available locally and can be covered in things like clear packing tape or contact to increase their durability. And they can be customized to include familiar people or places or other relevant words. So another really effective low-cost AAC strategy is partner-assisted scanning. So this is particularly useful for children who have a communication impairment and also have a significant physical impairment. So meaning they might not be able to use their hands to sign or to point to pictures. So in partner-assisted scanning, the communication partner reads out choices or points to options one at a time, and the person indicates yes or that's the one using any reliable response that they can. So this might be something like using a blink or a smile. So for example, the parent might ask, what would you like to play with? And then point to the ball, the car, and the book one at a time. The child would listen, and when the parent gets to the one that they want, they might blink to show that that's their choice. And what's great about this approach is that it doesn't have to require any equipment. You can point to objects, you could write down a list of words and read from that, or you could point to symbols. Whatever is available can still give someone a reliable way to make choices, express their preferences, and participate in conversations. I've got a little video next of a little boy using quite a complex communication book called a pod, but it's a really nice example of partner-assisted scanning. His mum is helping him to go through this book to find the options that he wants.
So Tassie and I use partner-assisted scanning. I scan through the options in his pod for him, and then he will tell me with a yes/no answer which option he wants, and then that dictates the conversation from there. Have you got something to say? Good job. Okay, more to say. Turn the page. I don't know when you go to the toilet. Yeah. More to say? Yeah. I think it's something's wrong. I have an idea it's time to. No. I want to do an activity. Yeah. I want to do an activity. No. Let's go. Yeah. Go went? No. For a drive? Drove? Visit? Yes. Turn the page. School people? I. Yeah. Me. Shop? Cafe? Yes. He's saying it's best if you visit the cafe. Yes.
So as you can see, it doesn't have to be a big communication book like that. It could just be a couple of objects or a single board. It still works in that same way. So like partner-assisted scanning, eye pointing is another option for children who have a communication impairment as well as a significant physical disability that makes pointing with their hands difficult or impossible. So instead of using their hands, the child uses their eyes to look at a picture or a symbol or a letter or an object to communicate their message. So an eTran board, and you can see some of them up here on the slide, is usually a clear plastic frame with symbols arranged around the edge, but it could be made from whatever is available. It could be made from cardboard or wood or PVC pipe. And the communication partner sits opposite the child with their face in the hole in the middle of the board and watches where the child's eyes are looking. And that is then the child's choice. So it can be called eye pointing, where they look at the option they want, and that's their form of pointing at it. And it can be used with letters, symbols, words, real objects, depending on the person's skills. Got a little example next of someone using an eTran board with letters on it to communicate.
This block, colour, blue, I. This block, colour, green, A. This block, colour, green, M. I am. This block, colour, green, A. This block, colour.
So as you can see, she looks at a corner of the screen. There's a few letters there, and then she looks at the colour corresponding with the letter. That's quite a complex system. It can also be used with more simple systems. There's a little example next of a boy using it just with 4 pictures to make a choice.
More. Have you got something else to say? You like this.
So that's a couple of examples of some low-tech AAC options, but technology can also play an important role when it's accessible and affordable, especially as access to smartphones and tablets increases. So the next 2 slides highlight some free AAC apps and open source resources that can help families and professionals to create AAC supports with no cost. So one example of a free AAC app is Seaboard, which was developed by UNICEF to make AAC more accessible around the world. So it's completely free, it works offline, and it can be used on phones, tablets, and computers. And one of the biggest strengths is its multilingual access. So it's available in more than 45 languages. And it uses the Global Symbols Library, which gives users access to thousands of symbols that can be used to create personalized communication boards. Another really useful feature is that the boards can be printed, meaning that the same vocabulary can be used on a high-tech board, on say a phone in some settings, but then it could be printed so that the same communication board could be used as a paper board in another setting. Another useful resource are free symbol libraries. So these can be used to create communication boards or communication books at little or no cost. So there are two examples up here. The first is the ARAS AAC, which provides thousands of free symbols and ready-made AAC resources. And the symbols can be downloaded and printed and adapted for individual needs. And then Global Symbols is another large symbol database, and they have symbols available in more than 20 languages. So it also allows users to create and customize communication boards and supports. And it has an AI symbol generator, so you can describe what you want in a symbol, and then it will generate it for you as well. So it can create some more specific and localized symbols if needed. These are just a couple of the resources that I know about, but I'm sure that there are many others that people have found useful that might be helpful for everyone to know. So please feel free to post in the chat anything that you're using for AAC or to support communication that could be helpful for others to know about. While people are popping some things into the chat, I'll finish up with a few key messages. So first, everyone has something to say, even if they can't rely on speech alone. AAC supports communication and can support people to develop speech and language skills. We don't need to wait for someone to be ready for AAC. Communication develops through access and opportunity. And successful AAC is never just about the device. It depends on families, teachers, therapists, and communication partners creating opportunities for the person to communicate. Thank you.
Thank you, Annie. That was brilliant. Really practical, low-cost strategies there too. So I've been collating a few questions and comments that people have mentioned. Amy, I'll get you to unmute yourself and we can go through some of these together. Please keep adding any questions that you have and I'll try and keep monitoring them. And then if you've got any questions that you want to ask and unmute yourself later, I'll give you some opportunity to do that too. But that was great. I'll start with Naomi. There was a question for you in the chat from Thembi, which said, in many of our communities, communication is really easily forgotten. And to be perfectly honest with you, Cindy, I don't think it's just your community. I think even here in Australia, communication, particularly in cerebral palsy, when physical disability can be really obvious, communication is often forgotten too. So Debbie goes on to say, because the child is labelled as non-verbal, caregivers often assume there's no point in trying to communicate with them. At the Malawi CP Register, we try and tackle this through a carer to carer program for caregivers and its communication component. However, this webinar has given us some fresh ideas to make the program stronger and to create better communication opportunities to improve outcomes for children. So thank you.
Thanks for sharing that, Thembi. I think, like Amanda said, I don't think you're alone. And I know even some of the families that I have worked with, when I've asked them about how their child's communicating, they just very quickly dismiss and say, my child can't communicate. And you can see through their interactions, they don't try to communicate. But I think that's where sometimes using the video feedback can be really helpful for a family. When you say, okay, we're not hearing them use words and maybe even their sounds might be limited, but let's video you interacting with the child. And then there's one family in particular that when I sat back and watched some of the videos, and I said to the parent, like I did with you tonight, I want you to wait and observe what your child's doing. And in the moment, the parent, I tried their very, very hardest, but I think often when you're waiting and you're not seeing much, you can, particularly when there's others in the room, you can feel quite awkward or frustrated. But when we looked back at this video, the parents started to realise that there were very subtle cues that their child was actually consistently doing. And when I said to the mum, it seemed like whenever your son wanted that next object, did you notice how his hand started just moving ever so slightly toward that object? And when she saw that, the realization of when this mum realized that her child was actually trying to send her a message, you really saw her really want to connect more with her son, even though it wasn't verbal at that point in time. She became much more sensitive to his cues, and that meant she was able to be responsive to his cues. And as she was responsive, he then tried initiating so much more. And he was quite little at the time. He was only 12 months old. And that same mum just sent me a video only a week ago of him using a whole lot of vocalizations and trying to say some words now, which not all of those words are clear, but she is now really enjoying her interactions with him because she's learnt that he is trying to communicate. It just isn't verbal. So I think those videos can be really helpful, a helpful way for parents to see maybe those subtle ways their children are communicating. I think as carers, we're designed to need that positive feedback to give us the motivation to keep communicating as well. So helping parents see that is really worthwhile, Denby.
Thanks, Naomi. That's really helpful. Thank you.
Thank you, Denby. Sorry, I didn't hear what you just unmuted yourself to say something, but it was hard to hear.
Oh, no, I said thank you. I said thank you.
Thank you. Wonderful. And just on that point too, Naomi, I know within my therapy, and it's the same with typically developing newborn babies, that often they will learn language through our response to them. And so even though some of the sounds they make might not, or movements they make might not be intentional, we can assign meaning to it through how we respond to them. And so I often give this example to parents when I say, a newborn or, a 6-month-old, 7-month-old, even 10-month-old baby might say mum, 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 mum. But to them at the start, that doesn't mean mum, mum. But our responses to it helps to shape that into meaning the word mum. So if whenever this baby says mum, 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 they're really just exploring the sounds that their mouth makes, but then suddenly mum appears and gives them a big hug, they're like, oh, that was kind of cool. I liked that when I did this. Mum came over and I got some attention from her. Maybe I'll try that again. So then they try and do the mum, mum, mum that they think is just a bit of fun, and then suddenly mum comes back and gives them lots of attention and a kiss and a cuddle too. And then over time, that response of mum appearing every time I do this teaches the child, when I say mum, mum, mum comes over, that must, that association builds and teaches them that mum, mum, it means mum. So the similar sort of thing, I think the video is great. Many of us have phones that we can access with video on there. So being able to film that and watch that back and cue into some of those subtle cues and respond to that can help to encourage the children to do more and more of that same behaviour. Is there anything else you wanted to add to that, Naomi?
No, that's great.
Abir Masad has said, is the communication matrix free to use? We were unable to access the scoring without a charge, as it appears to require a subscription. Can you please provide some support or guidance around this?
I think it was just last year they added a fee to the communication matrix. You can still access to free assessments when you sign up. And yeah, so you can access 2 before I think you start paying $5 US, $5 per assessment after that. But caregivers can also access the assessment, so they could access a free one for their child, and you could support them in working through it. But then, if you're trying to have under your own account multiple clients, you would need to start paying after the first 2 assessments.
That's a good idea to get parents.
Thank you.
No problem. Jakaya Sultana said, can we use a communication matrix in our settings, or is there a need for permission? I think that if you go to that website, you can access and use it if you create an account with them. There's a try it option as well. I just had a look, but you can't save your responses through that too. There is a website as well where you can buy for $5 US a PDF version that you could use too, rather than using the online version, so you can print that off. I just put a link to that as well. We have another question from...
Thank you so much.
You're very welcome. JK, you've also said that you shared your idea, which is lovely. I use family pictures and ADL books for communicating with your patients. So ADL books, I'm assuming, is that activities of daily living?
Yeah, activities of daily living, the baby's activities of daily living, which helps her or his more to communicate with others and to demand his or her need is very effective, I think.
Absolutely. Yeah.
Great.
And so,
Yeah.
Annie, do you want to jump in and say anything?
I think those are great ideas, and it sounds like there might be pictures of, like, photos of them actually doing those activities, which is really lovely as well.
Thank you to choose my idea. Thanks a lot.
You're very welcome. Having some photos of people as well might be a great way to get them to choose who they want to cuddle from, or who they want to help them with their eating and drinking for that meal, or having some pictures of some real objects. I had a question around, if you don't have access to a printer, Annie, you gave some great suggestions of choice making with real objects, or even writing a list down. What do you think about actually drawing some pictures? If you were to, do you have to be a really good drawer to be able to draw pictures?
Definitely not. I think drawing is an excellent idea, and I think we've probably all been there in our sessions, last minute drawing something on a whiteboard, and that can apply to drawing it on a piece of paper. You can stick some sticky tape over it to reuse it if you want to keep that for across multiple days. But no, you definitely don't need to have printed symbols. Hand drawing is ideal.
Wonderful. There was another question here. Do you recommend AAC application in home-based rehabilitation, especially in Ghana, where the absence of speech therapists remain a major challenge, especially in rural Ghana?
Yes, I can imagine that is very challenging, not having anyone there to support kind of that implementation. But I think we definitely want people to be able to communicate. So if there is someone you're working with and they're not able to use either verbal speech or some sort of gesture or sign to communicate effectively, definitely, if you can implement some sort of alternative communication with them, I would, definitely recommend that, whether that is some hand-drawn pictures, whether that's some symbols, whether you do have access to something like a phone where you could help them to download a free application. It would depend potentially on their access skills. So are they able to use their hands? So you've said an AAC application. So I think maybe you're referring to something on a device. So it would depend on what is available. If they have a device available, you could try that with them. But definitely we want to make sure that people have the option to communicate. So anything that we can do, it doesn't have to be high tech. Any sort of alternative communication for someone who's not able to communicate effectively using speech alone, I would definitely say yes, try and implement whatever you can.
Do you know of any good applications that are free? Or
Other than this,
applications that are free?
the Seaboard one, so the one by UNICEF, that is free, and you can do different number of symbols on a page. So for some people, they might only need a couple on a page. For some people, they might be able to have more. It might depend on their hand skills and what they can access, and also potentially their vision skills. It sort of varies country to country and language based. That's one of the ones that has the widest language options. Potentially there are some where you can record your own voice over it, so you could record the words in your own language. But a lot of them have subscription. They say they're free and then they have in-app costs once you download it. But the Seaboard one is definitely free to download and to use.
Thank you. And Karma Lucky has said, Naomi stressed on strategies, how to encourage communication, and Anne-Marie presented on AAC. When do you make that decision that a child would need AAC?
Do you want to start or do you want me to start, Naomi?
I'm happy either way. I think I think early on, whilst communication's developing, you're actually combining verbal communication with a whole lot of visual communication. So very expressive face, gestures, signs, using objects as well. And so I think very early on, you aren't necessarily differentiating, but using all those modes is important to support the child's understanding. But you then in time will start to see which of those modes of communication are they attempting to imitate. And so, yeah, Anne-Marie, at what point would you start to use potentially some low or high-tech AAC?
Yeah, I think you're right that those strategies, they're the same sort of strategies that, you know, you implement that early and you naturally use things like facial expression gestures, signing alongside that. Potentially, if you were doing all of those things and like those strategies you talked about where you're pausing and waiting, and if they're not able to vocalize, if they're not able to make a word, potentially then I might start introducing some pictures. And so like the research shows, it's not going to stop them from talking. If they're going to talk, they will, but it reduces that frustration. It gives them another option that if you're not sure, it's okay to introduce something like some pictures, because that's still quite a natural way to communicate. And so the child can either point to them, they can attempt to make that vocalization. It can help children to learn words because they're seeing that visual as well as you saying that word. So even if they don't end up using it to communicate, if they use verbal communication, it's still helping their language to develop. So it doesn't necessarily need to be an either or. I think they very much go hand in hand.
Yeah, and I think signing is an easy one to start to incorporate from a really young age. Even signs for words that you can use in many, many different settings, like more and finished, can be really powerful places to start. I put some links in the chat to a few different sign language dictionaries. We've got the American one, the Australian one, and the French one. They're the three main sign languages that other sign languages are then based on, so you can have a look at those too. And Shilpika has said, in India we use Avaz and the Jello app for AAC. Avaz is paid and Jello is free. So that's really good to know. I've used Avaz before. It's not a bad one, but I haven't heard of Jello. And then somebody, JK, you said in Bangladesh you use a high-tech AAC Balti Chai, which I haven't heard of either. That's great. Please share. There might be some that are in different languages too. I think the ones that we are mentioning are in English. I have a question as well. I suppose this is for both of you. Often we come across children who aren't really attending to us by looking at our faces, or perhaps they have a vision impairment and want to encourage some of that attention to our faces so that their interaction is more motivating for them sometimes. For those children who have vision impairment, or with those children who maybe aren't attending to the task or attending to you yet, do you have any strategies to try and help increase that attention to their communication partner? Naomi, do you want to?
Yeah, I think essentially you could start by seeing, are there things that you can control in the environment? And there won't always be, but if you can limit some of the distractions around, that can be really, really helpful. But again, like we talked about, ensuring that you really are face-to-face. If you're only sort of 30 to 50 centimetres away from the child, it makes it much easier for them to attend to your face. But they can, making sure that your facial expressions are really exaggerated and animated can also help them with attending. But you can be quite creative as well in, is there a colourful hat that you could put on, or something that will just draw them to looking at you to engage with you. Sometimes we'll even, if a child's having difficulty attending, sometimes we'll encourage with starting with those people and social games rather than playing with an object, so that they're looking at you and anticipating, say, that tickle that's about to come from you. Once a child has a desire to engage with you, they're much more motivated to communicate. Anne-Marie, do you have other ideas?
No, I think only adding to what you have suggested of, doing what you can to the environment. So making sure you're not standing in front of a window, for example, where all of the light might be coming into their eyes. Maybe turning the lights off and using a torch on your face to really highlight your face, and doing what you suggested of being really close, but that torch can help light up your features. Doing things like lipstick or glasses to add to your silly hat of drawing their attention to your face. And then I guess if you were going down the path of AAC and that was where you're at, using high contrast symbols, so using things on a black background with a big red symbol or a black symbol, or black and white, not adding too much complexity and colour into those symbols if that was what you were looking to introduce with those kids with vision difficulties.
Wonderful. Thank you. I think that's all of the questions we have, and it's right on 9 o'clock. Look at that. Yes, I just wanted to say thank you again to Naomi and Anne-Marie for your time, and thank you to Mahmoud and Ishrat for this invitation. It's been a real honour to be able to share the knowledge that we have with you and to hear about your experiences as well. So thank you very much.
Thank you, Amanda, Anne-Marie, and Naomi, for sharing your practical insights and experiences. And I strongly believe that the strategies, tips, and resources you have shared would be very helpful for professionals working in LMICs. And also thank you everyone who joined from different countries and contributed with thoughtful questions and comments. And we look forward to welcoming you into our future webinars. Just so you know, our next webinar is on early detection on CP, scheduled for August. Before we close, we would like to take a group photo. May I request you to please